All right, I think we're live. So episode 294, and we're excited to have you guys here. Uh, we have a great topic today. So we're going to be talking about what our blood sugar should be doing, which is really good because so many of you send messages throughout our webinars and say, my blood sugar was great when I went to bed and I fasted all night and then I woke up and it was really high. What's going on? Or should there be fluctuations in our blood sugar numbers? You know, what is healthy? What is our goal? And I will tell you that Dr. Saunders' goal for where your blood sugar is probably different than what you've been told. His goal is for you to not have to take medication. And I think sometimes when some of you have said that you've been, you know, meeting with your doctors will tell you a significantly higher number because they aren't looking to take you off your medications. They're okay with you being on them. They just want your blood sugar numbers down. So we're going to talk through some of that. I'm excited to chat through this. If you're here for the first time, comment. Let us know. Say hello in the chat. Those of you on Zoom, uh, you can comment in the chat, but when you ask your questions, will you just ask those in the Q&A? Just a little bit easier for us to manage all of those there. And then also just a reminder, Dr. Saunders is a doctor and he's wonderful, but he is not your doctor. And so we do ask that you consult with your healthcare provider before you implement any of the things that we are talking about today. Okay? So let's go ahead and get started. Actually, I'm going to see what we have here in the chat. A couple of people hopping on and saying hi. David is here. Delma is here. Joe says, tell us how long you've been a webinar participant. Yes, love that. We have Olu from the UK here. Barbara is here from South Central Texas. Susan is here from Santa Barbara. Wonderful. Okay, just a reminder, these are all recorded too, so you can go back and catch all the replays. Actually, you know what? I'm going to post the link here to this episode so that you can see that. You can go back and watch it. But this will also get you to our YouTube channel so that you can subscribe. And then you'll be notified every time we upload a new webinar. Okay? There we go. All right, Dr. Saunders, let's talk about our blood sugar. First of all, how do we even know what our blood sugar is? How do we check it?
Okay, this is actually an important topic right now for that question, how do we check it? Because we have a lot of different ways of checking it. And I have come up several times, people have come to me and said, what about those watches that check your blood sugar? You know, I don't have to stick my finger if I just put that watch on. So I looked it up, and it turns out those watches, what they do is they use your heart rate variability, and so they take several measurements, and they say this is probably what your blood sugar is at this time of day. It's not measuring your blood sugar. You can't use a watch to tell you what your blood sugar is if you have something like diabetes. It's not an accurate way of doing that. So at this point, the technology is not there. There's a lot of research going into that where they can use like the sweat coming out of your sweat glands to determine what your blood sugar is. But the technology isn't there yet. So the next thing we have is a continuous glucose monitor. And that uses a tiny little sample from the fluid, not blood. It's the fluid, interstitial fluid, it's called, that comes out of your blood. It's okay. It's a variable. And people who check their blood sugar by their finger and put a drop of blood on and say, hey, my continuous glucose monitor does not exactly equal what's on what my finger stick shows. Yeah, absolutely, that's true. And there are several reasons for that. One is you're looking at interstitial fluid and not the blood itself. So because of that, there's going to be some difference, and there's a delay difference in the blood sugar, so you don't have an immediate change in the blood sugar, the circulating blood sugar. When you have an immediate change in circulating blood sugar, you don't necessarily have that same change in the continuous glucose monitor. So it lags a little bit. And so the number's changing all the time. So how do you know? But even your finger stick glucose monitor is like within 20%. Well, 20%, think about that. If you have 100, what's 20%? That's between 90 and 110. So anywhere in there that's a good blood glucose monitor. And you're like, what the heck? That doesn't seem very accurate. Well, it's not, but it does give you an idea, and it gives you the concept. You get an idea of approximately where you are, and how things are changing. And so your continuous blood glucose monitor tells you the same thing. So the CGM is saying, look what happened when you ate after dinner. Every 5 minutes it's going up, 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 and it stays up for a long time. And you're going, okay, so that is a significant change, and that tells me something, that whatever I ate had a really bad effect on my blood sugar, right? And that's really what you want to know. The actual number is kind of less important, actually, compared to what effect it has. So that's why that's important. So what should my blood sugar be? Because when I go to the doctor says, well, if you can stay between 100 and 150, that's good, right? That's what the doctor says. But that's not what I say. Just like Leslie was saying, your actual optimum blood sugar is between 70 and 90. That's where you want it to be all the time. Well, why does the doctor tell me between 100 and 150? Well, the reason for that is because they don't want you to get hypoglycemia. They don't want you to get too low. And studies have shown that when people are using insulin or medications to try to get their blood sugar to normal, 70 to 90, they have a lot more reactions, and they die at a much higher rate, even in the hospital. These are studies that were done on people who were in the hospital, and they have 24-hour nursing, monitoring their blood sugar continuously, and they're giving them insulin IV, in an IV drip, so that they have this constant level, and they're getting their blood sugar down to normal, and they have more reactions and more deaths than if they allow the blood sugar between 100 and 150. So that's just all about expediency. What's expediency? Means that doing what's best in the moment, and not necessarily what's best overall. So what's best overall, yes, between 70 and 90. But it's a process of getting there. So what is that process? Well, we use the diabetes solution kit, and you go on a ketogenic diet, and you get your insulin sensitivity up, 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 so that you have less and less insulin resistance. And so that gradually your blood sugars, morning time, the one we're checking right in the morning, there's something called the dawn effect, where your blood sugar will shoot up in the morning. And that's because you've released a whole bunch of cortisol. The cortisol makes you insulin resistant, and you make a bunch of glucagon, and glucagon dumps sugar into your blood to keep you at a good level. And so if your thermostat for your glucose is set at 120, it's going to want to keep you at 120. And then you add in the insulin resistance from the cortisol, and now you have 150 or even 200, and you didn't eat anything. That's the weird part. And a lot of people say that, what? I didn't eat anything, and my blood sugar went up to 150. That is the dawn effect. But even that is an indication of insulin resistance. So in the morning, when you test, it should be between 70 and 90. And if it is between 70 and 90, you're good. That is normal blood sugar, and you have no issues with that. But But if it's still jumping up in the morning, even if you haven't eaten, don't just write it off as the dawn effect and say, oh, well, there's nothing I can do. No, that means you have insulin resistance. That means you keep working on it to get your insulin sensitivity up so that you don't have that anymore.
Good stuff. I love this. Feel free to post your questions in the Q&A. I'm gonna actually dig into some of these. Terry is here. I am considered pre-diabetic. And what does that mean? Let's tackle that real quick. What is pre-diabetic?
Okay, so there's a number of a line that's drawn for diabetes, and it would be a hemoglobin A1C of 6.5 and higher. And pre-diabetes would be a hemoglobin A1C of 5.7 to 6.4.
Okay. So Terry says, I have had nausea for years and can't get rid of it. It comes and goes. What can I do? And why is this happening?
Mm. Okay. Nausea is important. That's not something you should just let it go for years and take nausea pills or something like that. Especially chronic nausea, you should know why. And so the why could be gastritis, inflammation in your stomach, ulcers in your stomach, infections in your stomach like Helicobacter pylori. That could be a pancreatitis. Some people get chronic pancreatitis. It could be a liver problem, something with the gallbladder, the liver, blockages or sludge or something that's blocking that. It could be there's cancers that can show up, like especially things like a pancreatic cancer. At the head of the pancreas is where the bile duct comes out and the pancreatic duct comes out, and if those get blocked, then they can cause chronic nausea. And that's just the stuff in the intestines. If you have intestinal blockage or slowing down in the intestines, then that can cause nausea as well. And then there's the brain problems. There's problems in the brainstem, especially where the vagus nerve starts, or there can be autonomic nervous system dysfunctions. So there's a lot of possible reasons for nausea, and most of them are pretty important that you should know what they are and fix the problem instead of just relieving the symptom.
Again, if you could post your questions over in the Q&A, that would be wonderful. I want to ask this question here. How do you control your morning sugar level? Is there a cure for that?
Yes, the way you control it is by increasing insulin sensitivity. And you do that by when you don't eat sugar. Okay, so let's go into the details of this then. So what you have in pre-diabetes and then diabetes is you have a cell. And so you take this cell and it has a certain amount of sugar in it, glucose, right? And that's what it's using for energy. And it's also can use fat for energy. And that's the energy production in the mitochondria. They're in there and they're using glucose. And whenever you eat, then your pancreas makes insulin. And so when the glucose goes up, and there's insulin around, then the insulin binds to the receptor on the cell and says, open up and let the sugar in, and then it lets sugar in. When that fills up, then the cell stops making insulin receptors. And so now the cell, it's full of sugar, glucose, it doesn't need any insulin, doesn't need any glucose, so that it stops making insulin receptors. So insulin comes along and says, oh, there's nothing here, nothing here, nothing here. And meanwhile, the glucose in your blood is going up and up and up, right? And it's because the cells are already filled up to the brim. You can't put any more sugar in there. They're full. So if you eat sugar, it has nowhere to go. There's no cells for it to go into anymore. So it just goes up in the blood, and the blood's going up and up and up. And that's why the blood sugar goes up. So if you want to lower blood glucose at any time in any way, all you need is for those cells to open up and let more sugar in. So that's what the medications are supposed to do. But what they end up doing is stuffing the cells so full of sugar, you get fatty liver disease because the cells are dying and creating fat. And a lot of other cells are dying, including your brain cells, your nerve cells, your kidney cells. And so things stop working. And that's why medications are so dangerous for type 2 diabetes. So the way to do that is to use up all the glucose in the cells. So as it gets down lower and lower, it's kind of like your fuel tank in your car. You've got a full tank. You're not going to be stopping at gas stations and putting more fuel in there. So why are you eating all this sugar when your cells are completely filled up with sugar? It doesn't make any sense to do that. So as you're driving your car, you got a half a tank. You go, well, I could get another couple hundred miles, and so you get down to an eighth of a tank. You go, oh man, it's getting really close, and there's no gas stations nearby. And that's what the cell does. It's doing the same thing that you do when you're driving your car. You're looking at how much fuel you have and when you're going to need to fill up next. And so those cells, when they're full, they're not going to fill up. So you can eat all you want. It's not going to work. It's just going to make your blood sugar go up. So when you stop eating the glucose, then you start using it up in the cells, and it's going down and down and down gradually, half a tank. And we still got a lot. A quarter of a tank, eighth of a tank. Okay, we better start making some insulin receptors. And so then they make more insulin receptors. So they go, open up and let more glucose in. And that fills up the tank again. So that's the way the system works. And if you understand how the system works, it makes a lot of sense. So there's two things you can do to help this situation to make you more insulin sensitive. One is to use up all that glucose in your cells. How do you do that? Well, a good way, and because the muscle cells store a whole bunch of that glycogen, is exercise. If you're exercising, you're using up that glycogen, which is glucose, in the cells. And when they get down to low, then they go, hey, wait a minute, we need more. And they'll make more insulin receptors so that whenever you eat, it'll all come in, and you're not going to raise your blood glucose. Not in the morning, not in the evening, not anytime. So number one is exercise. Number two is don't eat sugar, don't eat glucose. That's what this phase one is all about. I mean, that's what we're talking about here is, okay, you can eat for other nutrients, you can eat fat and all of that. You need protein still, right? Because your body's still using protein to do all the metabolic processes. But what you don't need is sugar. You don't need glucose. So that's what diabetes is. You have an excess. You're toxic on glucose. So phase one, get the book and do phase one. And what that does is makes you more and more insulin sensitive as time goes on, so that your blood glucose every morning will be between 70 and 90.
And if you're curious about where to get that book, you can go to bartonwebinar.com. I posted that in the chat, and use code webinar25. You'll save 25% there. We go through all of this, and there are even some really good recipes for you in there. Dr. Saunders even put some of his favorites in there, so you're going to appreciate that. Okay, more questions. I love it. Keep them coming in the Q&A. That would be great. Susan said, are there any high lectin and oxalate foods you would recommend or recommend avoiding? Thank you.
Well, yeah. So high lectin foods, most of beans and peas and fruits and vegetables. Fruits not as much, but some fruits. I recommend avoiding the ones that you're reacting to, that you're sensitive to, that you have a problem with. So, most people tolerate tomatoes really well. But I have had several people in my practice over the years that have really had bad reactions to nightshades, tomatoes, potatoes, peppers, eggplant. let's see what else is in there. Tobacco. Anyway, those nightshades have solanine in them that is a lectin that some people react really strongly to, and it creates things like arthritis and leaky gut and those kinds of problems. Not everybody gets that, so some people tolerate it just fine and don't have any issues with it. So if you're having a reaction to some kind of lectins, then yes, you should avoid those. As far as oxalates go, uh, I have had one in 35 years, of somebody who got toxic on oxalates by eating kale. She was a nutritionist, and she said kale's the best thing in the world. It's got the nutrient to calorie ratio is better than any other food. It is the superfood of all superfoods. And so she was eating kale breakfast, lunch, and dinner. And the high oxalate caused her, it kind of chelates your minerals. So her magnesium dropped low. She started getting cramps, and she was having all these problems sleeping. And she's like, what the heck? And found out she was toxic on oxalic acids from kale. So as far as oxalates go, there's a couple of things you can do. If you really like kale for every meal, then take a magnesium pill with it. Because the magnesium will bind the oxalic acid in your intestines and it won't be absorbed. Or if it is absorbed, it'll still hold on to the magnesium and it'll be excreted with that supplement. So then that prevents you from pulling the calcium and magnesium out of your body, maybe. And that's actually been shown to work. Magnesium, for people that have oxalic acid problems, magnesium can prevent like kidney stones, for example. And that's actually been shown in research. So that's one way. The other way is just to eat things with high oxalic acid, like spinach and kale occasionally, just like, have them once in a while, but not for every meal.
All right. Diane says a new Endro has just prescribed insulin. Did me after more than 30 years of type 2 diabetes. I've understood that I'm insulin resistant. Is it not counterintuitive to give me insulin? When asked if I could get off insulin, she said no. To me, that's a death sentence. I watched my dad recently die with complications.
Wow. Okay, Diane, you're right. Endocrinologists are not taught about what I just told you about what insulin resistance is. And so if you have your cells all completely filled up to the brim with glucose and you dump more insulin in there, what are you doing? Well, you're stuffing them more full of glucose and causing more toxicity and causing the death of a lot of cells. And that's exactly what happens. And that's why people die of complications when they get on insulin. So I'm completely in your corner, Diane. Do phase 1 instead, and that'll work a lot better. I guarantee it.
Okay. Anonymous says, will taking advanced mitochondrial formula supplements help build mitochondria and help with increased energy and improve memory too?
Okay. There are a lot of advanced mitochondrial formula supplements, and I don't know which ones you're specifically talking about, but I have had some pretty good results with improving memory. People that have ADHD, it helps them, increases energy. And some people are deficient in these things, and they really help. So Stephen Sinatra's mitochondrial formula for hearts includes magnesium, L-carnitine, coenzyme Q10, and D-ribose. Most of them don't include ribose, but have some mixture of those with some other things like nicotinamide, vitamin B3, vitamin B12, the B vitamins mostly, and a few other things. It depends on what's in them. But, I've had people use these mitochondrial formulas very successfully and improve their function. So I'm not against them at all. Um, I test first as a rule. I want to know why and where the problem is. So if it's a methylation problem, we'll focus on that. If it's a sulfation problem, we'll focus on that. If it's a enzyme abnormality, then we'll focus on that. If it's an actual deficiency, then of course we focus on that. So I like to test to find out where the problem is specifically.
Okay. Kimberly says blood sugar in the morning is 91. Within 20 to 30 minutes, that's at 110 to 117. Is that the dawn effect?
That's the dawn effect. That's exactly what it does. Yeah, it's usually by 8 a.m. cortisol peaks, and that's the peak for the whole day. From there, it's all downhill for your cortisol levels. It affects your blood sugar most soon after you wake up. Yeah, that's the dawn effect.
Okay. Anonymous says what causes high serum ferritin levels?
Oh, that's a really interesting question. You know, most physicians are not taught this, and they don't know what ferritin really is and what it does. So I'm going to teach you something about ferritin because this is so cool. Ferritin is one of those miracle proteins, and what it does is it holds on to iron. That's all. It just grabs iron. It's an iron eater, and it holds on to it, and then it goes to the bone marrow, and the bone marrow can extract the iron out of it. Well, in the bone marrow, the iron is extracted out of it, and then it's used to make red blood cells. So you have this, millions of red blood cells being made every minute in your bone marrow, and the ferritin is bringing the iron in there, and it's pulling the iron out, and then the ferritin goes out and grabs iron from your blood because iron is an irritant. Iron is bad. Iron causes oxidation. Iron does inflammation, and it's not good for you. And so what causes the ferritin go up? Well, anytime you have inflammation, your serum ferritin level goes up so that you can grab all the extra iron. If you were to have a fall with internal bleeding or the bruising and all of that kind of stuff, your ferritin level goes up so that it can go out and eat up all and take all the iron out from the blood of it that's outside, that's in your tissues, and hold on to it and bring it into the bone marrow so that you can make more red blood cells. So ferritin is a storage form of iron, and that's what it's often referred to as. But it's also an acute phase reactant. And what that means is anytime you have acute inflammation, like something happens, like internal bleeding, bruising, or inflammation, infections, then ferritin levels go up too. Why? To grab up all the iron that's being created by the inflammation. So it's really an amazing system when you think about it. It's really miraculous.
All right. David said, I still have body itch and I'm a long-term diabetic. The only thing that seems to stop it is gabapentin, which also seems to help the extreme blood glucose variations. What are the dangers of gabapentin?
Okay, gabapentin works on the GABA system, sort of. It's kind of like something that slows down nerve conduction, but not a lot. It's almost it's it's highly variable in how it functions. So when people when it works on the GABA system, and it can stop the itching and all of that. It's one of those that, because it's kind of like a mild neurological, slows down in a mild way. It's not something that is dangerous. And it depends on the doses, of course. I have somebody that's taking a really low dose for sleep, and she says it works great. And I have other people that take it for neuropathy, and they say it works fine. And I've had the majority of people that I've had take it say it's useless. It doesn't do anything at all. So it's not that it always works. So no medication does. But it's also not very toxic. It doesn't work very often, but it's also not very toxic. I prescribe it, not commonly, but I prescribe it periodically, and I've used it. For David, I know you're in Colombia, and I don't know what access you have to getting diagnostic tests there. But the itching is a concern, and that type of neuropathy can often mean that there's other problems, things like toxicities, like liver issues. So you should do some tests to find out why. Why is that itching there? Is it a problem with the liver? Is there some toxicity or something that's causing that? And then if you have type 1 diabetes and you want to control the blood sugar without the extreme swings, extreme variations, instead of using gabapentin, you could be on phase 1 of the diabetes solution kit, and that will normalize. That will not make it normal, but um, uh, make it less variable, so that you have a more consistent or constant blood sugar, and that's a good thing. And that was our subject for today: is what should your blood sugar be? Well, between 70 and 90, kind of narrowly in that range. Like if you eat and it goes up to 100, that's okay, but fasting, it should be between 70 and 90.
All right. Kevin says, would would BC cause hot flashes? Maybe blood sugar is what we meant. I'm not sure. BC.
BC. Hmm.
I feel like I should know what that is. Okay, would BC cause hot flashes? I'm a 67-year-old male with occasional flashes at night. I never seem to have them during the day. Maybe blood
Okay.
sugar.
Um, I don't know if BC refers to diabetes or something else. But hot flashes in a male are often due to changes in hormones as well as females. So looking at, what is your testosterone levels, estrogen, progesterone, and the relationship between them. If you have occasional flashes at night and never during the day, that's not uncommon for hormonal changes. So that would be the first place to look. And so testing your hormones would be the best thing.
All right. Elaine says, I lost a quarter of my pancreas due to cancer, so I have to be on insulin shots. What are your thoughts on this to better control diabetes?
Okay, so a quarter of the pancreas, that's probably, usually something called a Whipple procedure, where they remove the head of the pancreas and you just have the tail. And so you have less ability to make insulin because most of those islet cells, beta cells, are not there. But there are enough to make insulin. So the first thing to do is to test and do a C peptide level and say, what is your C peptide? Because there are ways to handle this instead of injecting a lot of insulin. If you just need a small amount of insulin, that's okay. I have a patient that's doing that right now, who's had that procedure, and is using small amounts of insulin. But his goal is to go off insulin entirely, which is possible because we measured, and his insulin, his C peptide level is right around 1 all the time. So that's a low level, but it's enough if you're not eating a lot of glucose. So he needs to be in ketosis most of the time, and that actually works pretty well, where he doesn't need as much insulin. So a better control would be to use ketosis more, and to use your glucose less.
Okay. Follow-up question, Susan says, how much magnesium with kale? Thanks.
Oh, a magnesium supplement, and something like magnesium oxide is a better choice. That they have these chelated magnesium supplements that are just, the best, magnesium 3 and 8 and all those. But those are already chelated to an amino acid, so you don't want the chelated form. And they usually come in like 400 milligrams. You could just take one with a meal.
Okay. Sandra says, what's the name again for the insulin resistance book? A couple people had asked that. It's the Diabetes Solution Kit. You can find that at bartonwebinar.com and use code webinar25. That's one word. And that's actually posted in the chat. So if you're watching it, watching the comments, you'll be able to see that. Okay. Next question here. Let's see. I've had diabetes. This is from Olu. I've had diabetes since 2016. I've been complying with all instructions and avoided everything I should avoid. I spoke with my GP that I wanted to change metformin to berberine, but he refused. I showed him the synochroma. He refused again. Why are you doctors rejecting patients' choice of alternative medicine?
Uh, Good work, Olu. Yeah, hang in there. Um, it's, of course, you go to a medical doctor, you're going to get medicine. The doctor doesn't know anything about berberine. The doctor doesn't know anything about the supplements, vitamin D and chromium and vanadium in the synochroma. So if you don't know anything about it, then reject it. That's just the natural thing people do. But so if you go to a medical doctor, you're going to get medicine, and so don't expect that your doctor is going to know anything about chromium or cinnamon or anything like that. That's not part of this training. We were never trained in that. So if a doctor knows about it, it's because they've studied on their own separately, apart from their medical training. So, you got to expect that.
All right. Olu also wants to know why my blood sugar measurement has been fluctuating 165 to 91, back to 143, back to 86.
Okay. Well, that much is probably not because of the machine. It's probably due to your blood sugars actually going up and down. And the fluctuations could be for a lot of different reasons. There's a whole bunch of things that enter into what causes your glucose to be what it is. And part of it is eating, part of it is stress. So if you're insulin resistant somewhat and you have a bit of stress in a day, then your blood sugar can easily shoot up just because of that. But that's still an indication that you have insulin resistance. It should not go that high. So the underlying answer to your question is of why is it going up and down? It's because you have insulin resistance. So the answer to that is to make your body more insulin sensitive. So do phase 1 of the program.
Okay. Anonymous says, so if you have been a diabetic for years and you have been taking insulin, what's the best way to get off of insulin?
Okay, so if you're taking insulin, measure your C-peptide levels. The C-peptide tells you if your pancreas is making insulin. And if your pancreas is making insulin, then you can start working on getting off of the injections of insulin, because you say, oh, my pancreas is working, I don't need injections. If your pancreas is not working, if your C-peptide is 0, then you may need injections for the rest of your life. So looking at that is the first step. And then you start working on it by decreasing the amount of glucose in the cells. So you deplete your cells of glucose by not eating any. And that's what phase 1 of the program is. So go back to phase 1, start with that until you're super insulin sensitive. And then the little bit of insulin that your pancreas is making will be able to fill all of your cells up.
Whitney says it seems like inflammation is behind all of our ills. How do we test for this and what can be done if our levels are too high?
Oh, that's a good point. Okay. So inflammation is a very common problem much of what ails people. And that's, everything from cancer to heart disease to diabetes. So the question is, what can we do about this inflammation? Number one is, why is the inflammation there in the first place? That's where you have to go first. Because if you have a chronic infection, then you have to deal with the infectious disease to get rid of the inflammation. But having extra fat in your fat cells causes inflammation too. So sometimes just having type 2 diabetes causes the inflammation. So getting the glucose down to normal, using up fat for energy, will actually decrease the inflammation as well. So when you have inflammation, deal with the underlying cause. Why is the inflammation there? And then deal with that.
Okay. Let's see. Anonymous said, I find that eating healthy, non-sugary food, an egg and some nuts, brings down my sugar from 12 or 120 to 140 to below 100. Does that make sense?
Eating healthy non-sugar foods, yeah, that makes sense. That's phase one of the program. that's what we do. That's what we're teaching you to do, is to eat healthy non-sugary foods, so that you start using up that extra sugar and you're not just adding more sugar into your blood sugar every time you eat.
Unless you're saying if your blood sugar is at 140 and you eat that and then within 3 minutes it drops down, maybe that's what you're saying.
That could be, and that would be a different issue. That would mean that because you're eating, you're releasing insulin, but you didn't eat anything with sugar in it, so your insulin's bringing your blood sugar down below 100, and that's okay too.
Right. Anonymous said, I've heard that berberine helps keep blood sugar down. Would you recommend that for someone with type 2 diabetes instead of metformin?
I usually use it instead of metformin. When I started looking at the research in metformin, found that people, when you're exercising, you can't build muscle cells, and it doesn't help your metabolism to become more fat burning. That's what it's supposed to do, and it does initially, but then when you go off it, then it doesn't work anymore. Of course it doesn't. So yes, I think berberine is a better choice.
Okay. Gail says, I can't afford the supplements right now, but I really miss my synochroma. So I'm making my own concoctions like morning, having apple cider vinegar with a teaspoon of turmeric and ginger with black pepper and half a teaspoon of cayenne. Is that good for me?
Wow, sounds powerful. Turmeric, ginger, black pepper, cayenne. Whew. Yeah, that's great.
All right. Diane said, I've cared for both parents the last 3 years. They both passed this year under serious stress. Since January, I've been on Tylenol 3 for compression fracture in spine and bulging discs. 1.5 weeks off of T3, so I don't have to eat every 4 hours with medication. My bowels are seriously backed up. Is it still good to go back to stage one, phase one with this issue? I've been to the emergency once. I love your cream cheese pancakes. It is painful to stand to cook.
Okay, yeah. Dealing with pain, chronic pain is just so hard. It's, just always being in pain. You can never get comfortable. That is so hard. And so people take, Tylenol 3, Vicodin, all those kind of things, like continuously. Okay, so and that often causes constipation, but it's odd that going off of it would cause constipation, because you'd expect just the opposite. People who stop taking, whatever, codeine, morphine, all that, opiates, often get diarrhea because their intestines start uh, uh, moving more. But yeah, if it's backed up, yeah, go to phase one, and in phase one, do a lot of the fibers. So you wouldn't do fruit; you would do a lot of vegetables, though. And there's a whole bunch of free vegetables on there. You can have all of the lettuce and kale and spinach and celery and broccoli and cauliflower. And, there's this whole list of foods that you can have in there, as much as you want, and you don't have to count them as carbs. And those will add fiber and should help you be more regular too.
Okay. Okay, so Olu was wondering, what is your opinion on having to take these medications, as I love these from Joe's information about them. So I think Olu, what you're talking about is the supplements, not the medications. So probably, I'm trying to think of what you had mentioned before. So Olu's really trying to figure out a good program for insulin, maybe insulin resistance, it sounds like, right? And
Yeah, the simplest thing. There was a famous physician, the first doctor to write a textbook on internal medicine, Sir William Osler, was trying to get people off of medications, ironically. And he said, the only difference between man and animals is man's desire to take pills. And that was supposed to be funny, but it's actually kind of a real thing that people really like to take pills. But the pills aren't the answer in this kind of a case. If you have type 2, then what you want to do is deplete all of your cells of glucose by not eating any. And so if you don't eat any, then you use up what's already in there, and then they make more insulin receptors, and that makes you more sensitive to insulin. And that's what our goal is. So the medications, the supplements, those aren't going to make you more sensitive to insulin. It's really doing phase 1 of the program that does that. Are you muted?
how does lifting ankle help in controlling blood sugar?
Um, Lifting ankle. So when you're standing and you're lifting your ankles and you're lifting your heels off the ground, you're using a muscle, a big muscle, the gastrocnemius muscle. And the constant motion has been shown to decrease blood sugar, to improve insulin resistance, and it's just simply exercise. You're using energy by doing that.
I think
Okay.
we had a marketing video that I did recently doing calf, up and down on stairs, and like talked about the blood flow in your calf because it's further away from your heart, so your blood has to pump further and it gets that circulation going closer to your feet as well. I don't know if there's like what the science is on that, but yeah.
Okay. Let's see. Elaine says, how do you test for the C peptide level?
Okay, CPAP, a doctor can order it, or in some states, you can actually walk into a lab and order it yourself. And it's just a C peptide. It's pretty simple. Everybody should know it. It's on most labs. I send them to local labs, Quest, all over the country.
Okay. Cynthia says, can medication cause plaque in the arteries?
Let's see, medication. I can't think of any medications that cause plaque in the arteries. If you increase your clotting or decrease your ability to dissolve clots, those can. So I'm sure there are some, but no, I don't think that's a concern. It's not really plaque causing medication causing a plaque problem. I think people who have a plaque problem have a plaque problem, and the medication just doesn't fix it.
Okay. All right. Don says, annual checkup yesterday with blood work, cholesterol 259, HDL 45, LDL 188, triglycerides 129, A1C 5.9. Doc wants me on Zetia or Zetia to bring down the super high LDL. Is he shooting at the wrong target?
Absolutely. That's the wrong target. So the optimum cholesterol is between 210 and 250, and you're just a little above that. And your HDL is a little low, your triglycerides are a little high. So I'll bet if your A1C, if you can get your A1C down in the 5.0 to 5.2 range, your triglycerides will be lower, your HDL will be higher, and I think all of your numbers would be much better. Zetia is not going to help you to live longer or improve your life in any way, whereas getting your triglycerides down will give you more energy. So you'll have more energy and your cholesterol numbers will be better, by the way.
All right. And it'll be cheaper.
And it'll be cheaper.
Anonymous says, is it okay to take berberine along with metformin or not?
Hmm. Uh, uh, I'm pretty sure it's okay, but I looked it up and I couldn't find any research on the two of them together. So I don't know. I don't know of any studies that have been done on that, but I know people who do it take them together, and it doesn't seem to be a problem.
Okay. How much berberine is recommended for insulin resistance?
Oh, that's a good question. So remember the pill is not the issue. The issue is to deplete your cells that are so full of glucose that you've shut off your insulin receptors. So you want to have less. Berberine is something that helps you to use fat for energy. And so it allows you to have more energy. And so there's benefits to that. But the insulin resistance is actually fixed by not eating glucose. That's and exercising. So exercise, don't eat glucose. Two things. And then berberine, if you want to help with that insulin resistance, it needs to be taken at least twice a day. 3 times a day is better. So 500 milligrams 3 times a day would be better for insulin resistance.
Okay. Juliana says, how do you treat gout in your thumb?
Gout in your thumb. Okay, so it's not common to have gout in the thumb. Gout is usually in the feet, in the large toe, at the base of the big toe. But you can get gout in any joint, so it's not completely out of the question. So the question is, how do you treat gout? And that's a really important thing in relation to type 2 diabetes, because as your insulin goes up, your uric acid level goes up. And uric acid is what creates gout. So uric acid forms crystals in joints when they get cold, so that those crystals then get eaten by white blood cells and they create a lot of inflammation. So that's what gout is. So if you don't have high uric acid, then you won't have gout. So if you have type 2, the best way to treat it is to get your blood sugar way down, your insulin sensitivity way up, so that you don't make uric acid, so that you don't have gout anymore.
Okay. Okay, our time is up. Thank you, Dr. Saunders. We appreciate you so much. Come back next week, everyone. And he'll be back. The doc will be back.
Bye-bye.
Thanks,
Bye.
everyone.
Thank you.
Bye.
Bye, Joe.
Bye.
Bye-bye.